Methodology of Six Sigma by Claire Dunker. The history of Six Sigma can be traced back to the early industrial era. Walter Shewhart discovered that 3 sigma deviations or more from the mean indicates a need for a process correction. Six Sigma was only seen as a statistical measurement until it was adapted by a Motorola company in the 1980s. Motorola gave Six Sigma a much clearer definition by developing it into a process that could be used by businesses to improve quality and customer satisfaction. The company also copyrighted the term Six Sigma. There are 6 main strategies related to Six Sigma. The customer comes first. Management decisions must be based on facts. Excessive amount of attention should be focused on management, improvements, and processes. Create a proactive management team. Collaboration must be done without boundaries. Every part of the company must be involved in collaborative decisions. Different belts are awarded based on certification and level of expertise, example black belts. These individuals are able to lead companies in learning how to implement Six Sigma. One key feature of Six Sigma involves the DMAIC method. It is broken down into defining the problem, measuring performance success, analyzing processes to determine the cause of variation, improving process performance, and then controlling improved future processes. Strengths of Six Sigma include its proven success over decades, its potential financial savings, and that it improves customer value. Six Sigma focuses largely on improved teamwork and communication, which lead to increased job satisfaction and customer value. Six Sigma weaknesses include its complicated nature, its potential to decrease job satisfaction, and the need for complete participation, because part of Six Sigma includes job incentives or rewards for improved performance. A lack of commitment or understanding by an employee can lead to lowered performance. Not understanding the complicated nature of Six Sigma inevitably leads to a less than desired performance outcome. Also, because it requires complete participation from every entity in a company, it can be much more difficult for larger companies to be successful with Six Sigma. Six Sigma's application to the current healthcare environment. There are 4 metrics that can be applied to the healthcare industry. Service level, service cost, customer satisfaction, and clinical excellence. Six Sigma is applied by defining the goal of the project, example improve patient waiting time. Defining upper and lower control limits to determine an acceptable level of performance, example the maximum desired average patient waiting time versus the lowest desired waiting before quality of service may be affected. Monitoring performance and gathering performance data, example examine patient waiting line system. Analyzing root causes, if performance drops below control limits, and then taking steps to correct/improve identified issues. Here are some brief examples of Six Sigma's successful implementation into the healthcare industry. A private practice in Turkey used Six Sigma to successfully reduce the number of complications during and after intravitreal injection. Next, a hospital in the Netherlands decreased the length of stay for patients with chronic obstructive pulmonary disease. Medication safety and coordination of care were greatly improved at the Charleston Area Medical Center in West Virginia after the use of Six Sigma. The customer or resident always comes first. Our residents are the reason why we have jobs at all, and their overall satisfaction is our number 1 commitment. Management would place a large emphasis on making sure that our med passers and care providers work together as a team while delivering a high level of care and service to our residents. Right now, the facility I work in has 6 floors. We would split into teams on each floor, and as team work together to get residents their meds and the care they need. That leads us to fact-based nurse management. Keeping the same people on specific floors helps to build resident satisfaction more than if we constantly switch employees around. Investing in knowing the facts about situations with residents helps with problem solving. Accurate and developed problem-solving skills create improved processes. and building strategies on floors will hopefully improve the overall satisfaction of the residents and other departments.